Coming to the next point about the contact transmission, if you come first topic in this transmission based precautions, as I discussed earlier in the module, there are two types of contact transmission. One is through direct contact and another is through indirect contact. Direct contact, whenever I say, that means it is a direct body surface to body surface contact or the physical transfer of microorganisms between a susceptible host and an infected or colonized person. This is where I am going to take the contact transmission. Example, suppose if I have a patient, post bone marrow transplant patient, immunocompromised, and suppose if I keep a healthcare worker who is already colonized with MRSA or VRE, that means I am increasing the problem there. I am making this susceptible host to get exposed to these pathogens, MDRO pathogens. So, I need to follow contact transmission there, or I need to change the worker there. So, that is where the things, wherever this comes into contact, the transmission of infections happens. The second mode of infection is through indirect contact. Contact of a susceptible host with a contaminated inanimate objects, usually the contaminated instruments, it could be a needles, simple dressing pads or contaminated hands and gloves or the commonly touching surfaces. This is how the spread of infection occurs in the contact transmission. Either it could be a direct or it could be a indirect transmission. If you come to the contact isolations for the persons who are suffering from the diseases and who needs contact isolations, then the diseases mostly are MRSA. There is a methicillin resistant Staphylococcus aureus or VRE, vancomycin resistance enterococcus, or it could be CRE, Carbaminomeus resistance enterobacteriaceae. So, in that way it is so on, where you need to first identify what type of infection the person is suffering from. Second thing, what type of isolation precautions I need to follow in this patient. Suppose if we take example in this patient, patient has an MRSA wound oozing pus from there, I cannot keep this patient in the center of the ward surrounded by a patient who have post operative care. I may get surgical site infection due to transfer of infection from this patient to another patient. So, this is how you are going to divide and cohort your patient. And whenever you say that it is a contact precautions, it is not only for the bacterial diseases, even for some of the viral diseases like SARS, severe acute respiratory syndrome, RSV, it is a respiratory syncytial virus, where it needs not only droplet precautions, but it also needs a contact precautions. The contact precautions, what are you going to keep the board? How are you going to design the policy there? What are the basic requirements for the contact precaution? If you see, the first thing is, if it is available, the patient should be kept in private room or it should be cohorted. It should be kept in a corner of the room, and make sure that whoever is attending that patient should wear gowns and gloves prior to entry. Hand hygiene is very, very important. See, hand hygiene is the pillar of all the preventive aspects, whatever you do best to prevent the infection. Hand hygiene is the first and the foremost thing which you have to follow, irrespective of whichever disease you are dealing with. So, here again it comes the hand hygiene, dedicated equipment. Most of the time we see that the equipments have been shared from the patient who is suffering from C. diff, MRSA or VRE, and the same instruments have been used for the next patient who is free from all these infections. So, this could be a source of infection. So, if you have to dedicate the equipment and disinfect the shared equipments immediately if the patient get discharged. After the patient get discharged, make sure the equipments get disinfected properly. Otherwise, this could be a reservoir of infection, and whenever the susceptible host come, it can catch that and it cause an infection in the patient. So, in brief, the contact precautions, the first thing you need to follow is hand hygiene before entering and before leaving the room. Second, wear gloves when entering the room or when touching the patient's intact skin surfaces or an articles close to the patient, and wear gowns when there is chances there you may come into touch with the patient's cloths and potentially contaminated or environmental surfaces. So, this is what you are going to do for the contact precautions. Using a hand wash, make sure that the sink is available near to the patient, otherwise most of the times we see the contact precautions is required. Consultant, the doctor who is attending the patient, nurses who are attending the patient, they want to do hand wash, but the sinks are located at very far place where they feel that going so far is takes time and they cannot give so much time for hand washing and they overlook that step. that would be potential hazard in the hospital, because just of the non-availability of hand sanitizers or a sink to wash the hands near to the patient area. So, make sure when you are cohorting or isolating the patient, hand washing facilities should be there in a nearby place. Personal protective equipments, at least gloves, gowns should be there, and also make sure that the dedicated equipment should be there. Try to restrict the equipments and usage, do not share that equipments with other patients like BP curve, thermometer and other things. So, this is what we are going to do in contact precautions. So, now the listeners, the first thing is that what are the diseases that when you come across, you need to implement contact precautions, that is bacterial and viral. Bacterial are MDROs, multi-drug resistant organisms like MRSA, VRE, CRE, and some viral infections where you need a combination of transmission based precautions, not only contact but also droplet in the cases where you come across SARS and RSV and other types of viral infections. See, this is a special addition where a special enteric requirement what you need to do. This is for the patient who are having Clostridium difficile, norovirus or cholera, diarrhea, where not only you are using the alcohol rub, but you are making sure that you do hand wash with soap and water before and after leaving the room, because as I told you in the previous module, some of the pathogens like Clostridium difficile, Vibrio cholerae needs proper hand washing, because the C. diff spores are especially resistant to the antiseptics which we use normally in our hospitals. For these patients, the contact precautions, especially the diseases where you are dealing with having C. diff, norovirus, cholera, you also need to wash your hands with soap and water. What are the things that are needed for the contact isolation? To be very practical, you need to have a dedicated equipment. If you see here the first part of the slide, you need to have a proper discarding area, separated discarding area and the last bed, but not in the middle or the first bed. Suppose if your hospital is not having a single room available, then you can still use the last bed or the most cornered bed in the ward, so that the minimum transmission of infections can happen there and the entry of the other person will be very, very less. Though you need to have an isolation cart, you need to have an isolation dedicated equipments and find all necessary PPE in isolation cart. You should have a gloves, at least it should have a gowns there in a place whenever it is needed, and proper biomedical waste segregation area next to that. So, in the contact isolation, these are the basic requirements which you are going to have. Coming to the diseases that requires the contact isolation, as I already told you just now, MRSA, VRE, ESBL E. coli and an extended spectrum beta lactamases, where you find most of the basic antibiotics, narrow spectrum antibiotics like cephalosporins first generation, second, third generation cephalosporins, even the quinolones, aminoglycosides, beta lactams will be resistant to extended spectrum beta lactamases, where we need to use a broad spectrum antibiotic where we have a BL-BLI combinations, beta lactam plus beta lactamase inhibitors combination. And in MRSA, we need to use a higher antibiotics, reserved antibiotics like vancomycin, linezolid, because most of these bacteria, they produce an enzyme which will be dissolve the narrow spectrum antibiotics, which will be resistant to the narrow spectrum antibiotics. So, that is how where the problem comes. So, for these patients, you need to have a proper contact isolations, and the patients who are having C. diff, many of our hospitals they use antibiotics for a long time, and later on 4th or 5th day of the admission, you see that the patient is having diarrhea, antibiotic associated diarrhea. If you could able to test it for Clostridium difficile, it could be positive. It may cause pseudomembranous colitis and major complications, and you have totally stopped the antibiotic and you have to treat C. diff, because this can cause a disaster in the patient. We often come across the patients who are taking beta lactams, penicillin groups with a diarrhea, 4th or 5th day after consuming the antibiotics, they have diarrhea. So, we have to test it, and if you come across C. diff in that, you have to follow contact isolation in that patient. Norovirus, scabies, viral conjunctivitis, these are the diseases where you need to follow the contact isolation. See, in this slide, viewers, what you find is a non-compliance here. I think it is very obvious, whoever is discarding the biomedical waste is not wearing gloves. Just now I told you the gloves are important. So, what happened here? There are chances that the healthcare provider may get infected, whether he or she is from a housekeeping staff or a nursing staff or a doctor. So, they are not wearing personal protective equipment here. So, at least the gloves has to be wear here when discarding the biomedical waste. This is in brief about the contact transmissions.